Peace be to you all. Omar here, physician associate, health educator, and middle-aged endurance runner. So I thought I would talk to you guys about a topic which I had not broached for some time, and that is the need for maturity in the healthcare profession. So for those of you guys who may not know me, I've been in the allied health field for a little over 30 years. I started out as a nursing assistant, certified nursing assistant, and I've spent the past little over 20 years as a certified and licensed physician assistant, or now called a physician associate. So I'm currently working in a private practice. So I've never worked in this capacity before, so it's an interesting adjustment. But I also mentor pre-PA and PA students. I was talking to a young lady today who's just been accepted to a PA program. She's only 18 years old, which kind of blew my mind because I've got children that age. And I was like, wow, God, one of my kids could be on their way to becoming a PA. It's very interesting to me. Although it did take me back to where I was teaching. I taught at a university PA program many years ago for about 4 years, and my youngest student was 18, and my oldest student was 63. So in PA school, you'll have a very broad range of ages. I think for my class, the average age was probably about the early 30s, I want to say. I was 30 years old when I started PA school, and it was a second career for me. So you're going to have a lot of maturity because of that broad age range. You're going to have people who are just starting out in life, like this young lady just graduated high school, did extremely well enough to get into an accelerated program. I didn't know those existed. What's like a combination undergrad, grad PA program. And I was just telling her that, in PA school, it does take a lot of intelligence. It takes a lot of management of your time. I've discussed this in other videos. But it also takes a lot of maturity, and I would say moral fortitude, because if you think about it from a provider's standpoint, as a physician associate, you're going to be on a relatively advanced level in terms of provider. You're not the physician, so I don't want anybody to get it twisted. We don't have the length of training as of physicians. They do 4 years undergraduate, 4 years medical school, then a minimal of a 3-year residency if you're doing something like internal medicine or pediatrics. Then if you want to specialize, you do another year or two of fellowship. So we don't have that training. All the more reason why we need to be more mature than other fields, because you're coming out at such a young age. I worked with a PA who was, I think this PA was 23 years old. Well, I've got kids that age. It's like, wow. It's, again, I go, everything now for me is relative to what my kids, are doing, because of their age. They're young adults now. And I look at them, I'm like, okay, you're mature, but you got some growth and maturation to do. So in the PA field, if you think about it, the patients that are coming in to see you, they're coming in because they're so concerned about their health that they're willing to strip naked in front of you and let you stick, your fingers, your lubricated fingers, depending on what you're doing. If it's a digital rectal exam or a vaginal exam or something like that, or an instruments, whether it's a speculum or a simple ophthalmoscope or otoscope, like I use, into their God-given orifices, so their ears, mouths, nether regions, genitalia, rectum, and things like that, and trust you. So you have to have a very high degree of morality, one that you're not going to breach any type of trust. You're not going to molest the person, as unfortunately was done in this case of this. I don't even want to mention this doctor's name, who molested all of the female gymnast. It's a very vile, sick evil man. So he breached that trust. But you have to understand that your patients are placing almost total trust in you. I've had patients tell me things that they've haven't even told their own family. Got patients with HIV, patients with profound mental illness. We just had past the month of May. Last May was Mental Health Awareness Month. So I've got patients who tell me about their mental illnesses, and their family members don't know about it. Other family members or other patients who've got they're dealing with different addictions. Their families don't know about it. Their friends don't know about it. Some have got other actual diseases that they don't want their family members or friends knowing about. I can't breach that trust. So that takes a good deal of morality and maturity. We have HIPAA, just I guess the Health Information Portability Act of 2006. You'll learn about that in school if you haven't already, if you don't already know about it. So we're not supposed to, legally, we're not supposed to breach confidentiality. But just from a moral standpoint, some of us are in the same communities. I live and work in Washington, D.C. It's a very small place, so news can travel fast. If I call somebody and say, I got so-and-so as a patient. He's got this. Did y'all know about that? I've just violated that person's trust in me. I've crossed breached a moral barrier that shouldn't be crossed. And in terms of your competency, those are things that come with reading and practice and skill. So the young lady who's the PA student to whom I spoke to today, I was telling her about the various things that I do when I'm seeing patients. And she's like, "Wow, how do you know all of that?" I said, "Well, because I've spent decades reading, decades taking care of people. So you're going to know things on a higher level than the average person." But everybody's an expert now, right? Because we've got Dr. Google and Dr. YouTube. It's like Islam. You go to Shia, Google for things Islamically. But we have to be careful in terms of how we treat patients because they have almost total trust in us. So you want to be a mature person. Going into PA school, when I was on the admissions committees for PA programs, that's something that I always looked at was this person somebody who was mature enough, not just to get through the rigors of the PA program, but were they going to be mature enough to be good clinicians, good healthcare providers. And while you're in PA school, you're not always going to get along with your classmates or your professors, or certainly not your chief residents and your attending physicians. But you have to have the maturity to get along with your classmates and all those other people that are going to help train you. Because really, at the end of the day, it's about providing efficacious health care in a manner that is intelligent, clinically sound, but also morally upright. Right, that's it for now. I wish you guys the best of success in your positive endeavors. If you want to be mentored by me or just want to check out my YouTube videos, please feel free to subscribe. Take care. Peace.